Let's take you to some international news now. The UK is headed back to a national lockdown. It will begin on Thursday and be in place until at least the 2nd of December. Prime Minister Boris Johnson made the announcement as the country passed the 1 million cases mark. Correspondent Olly Barratt joins us now with the latest. Olly, English Prime Minister Johnson has made a tough choice, but he says no responsible leader could ignore the rising cases. What was the main motivation behind this drastic move? The fear that without intervention, the NHS just wouldn't cope and would be overwhelmed?
Absolutely. If you listen to the Prime Minister, that is exactly what the motivation is. He says that the data added to some new projections from the scientists that advise the UK government is leading to some scenarios which would be really unpalatable for the United Kingdom, including the National Health Service being overwhelmed, deaths rising to a point where they far outstrip the daily numbers we were seeing during the peak of the outbreak here in the UK back in March, April and May, hospitalisations spiking as well. And Boris Johnson says that simply because of all of that data and those projections, now is the time to act. Of course, he will face criticism for the timing of this action. The opposition Labour Party has been calling for a lockdown of this type for some weeks. Scientists advising the government suggested one as early as the middle of September as well. So one of the crucial questions for Boris Johnson now does become the timing and whether that has put lives in danger. Boris Johnson insisting that it was right to try that localised approach, that regional tiered restrictions first, but he says the numbers simply add up now to a position where another national lockdown for England is necessary.
Olly, did the government and their scientists advising them identify why that tiered localised lockdown system didn't work?
Well, this is one of the key questions that is now being asked of the government by some of its own Conservative MPs who are really curious when they look at the data of things that have actually happened. The case numbers in many parts of the country appear to be slowing, even though they're rising in other regions. We are not seeing an explosive growth in cases, confirmed cases, on a national basis. The number from the last 24-hour period, for example, 21,915 new cases compared to 23,012 the previous Saturday. Now, deaths have jumped a bit in that period to quite high levels already. 326 deaths announced over the last 24-hour period compared to 174 the week before. But some MPs are looking at data from their own regions and saying it looks like the tiered restrictions might be starting to have an effect. The rate in increase when it comes to case numbers in our local area is slowing, if not falling. So why are we now moving to this much stricter lockdown? And the answer lies somewhere in the projections that are now being made by UK scientists, and that is leading to further questions from Conservative MPs and some other critics of the government saying, look, we need to know what those projections, what those scenarios are based on. What are the assumptions that are being made that have led us to change policy quite quickly? Because bear in mind, as recently as Friday, cabinet ministers were out saying that the regional approach was the right one and that a national lockdown was not the right move.
So how will this affect the government aid to those who are unable to work from home and unable to meet their financial commitments, both in terms of businesses and in terms of private individuals? And based on that economic response, what has been the word on the streets? Here in South Africa, when rumours started surfacing about a possible return to more restrictive levels of lockdown, there was a nationwide outcry, people saying they would refuse to adhere to restrictions. What is it like on the streets in England?
Well, that issue of compliance is going to be critical to whether this new lockdown works or doesn't work. Certainly, government scientists believe that to be the case. And there is really a question about how much the British public are going to go along with it. The polling suggests there is support for another lockdown. The polling suggests that people say they will abide by the rules, but will they actually when it comes down to it? The government had a very difficult decision to make here, and when it did so, it knew it would have to put further financial support in place. A furlough scheme that's been paying up to 80% of workers' wages up to a certain level throughout this pandemic pandemic period was actually due to come to an end today. And so yesterday, when Prime Minister Boris Johnson announced this further new national lockdown for a month, he announced that that furlough scheme would be extended for the duration of it, so through until December. Now, that is going to cost the UK exchequer hundreds of millions of pounds. It will mean that more people have some kind of certainty about where income will be coming from for the next few weeks. It should mean that some people are retained by their employers rather than made redundant. But it's also led to more accusations that the government is making another U-turn, because the furlough scheme was due to be coming to an end. The opposition Labour Party for some time have been saying it should be extended. The government said it shouldn't be extended, and now it is being.
So those who are vulnerable are not being asked to shield in the same way as they did in the spring and the early summer. What's different now? And run us through the basics of this restriction.
Right, so we heard from Chris Whitty, the Chief Medical Officer, alongside the Prime Minister, and he was saying that the government and its researchers have been looking in huge detail about what happened during the previous lockdown, March, April, May, what worked, what didn't. And they've said that there were some real issues back during that period of loneliness, of impacts on people's health and mental health from being in that shielded category. And so what the government is saying this time around to people who might be more vulnerable to COVID-19 than others is saying, be really as careful as you possibly can. Cut down your social contacts even more than other people are doing. But we're not going to urge everyone to shield as strictly as last time around because of those some of those negative effects that it can have. So this new national lockdown in many ways feels similar to what we saw imposed in March, but in other ways it is different. So schools are going to be kept open this time around as well. Differences in shielding. There are some parts of the economy which will keep going in a way that they didn't back when the March lockdown was imposed, but certainly for many people who had to stop working last time around and will have to stop working this time around as well, there's a deep level of anxiety about what's to come and, crucially, how long this will last. When Boris Johnson announced this new lockdown, he seemed pretty clear that it would end on December the 2nd and then the UK would move back into those tiered restrictions. Michael Gove, the Cabinet Office Minister, today, though, talking to broadcasters, said there would be a review on December the 2nd. So there is real fear now that if numbers don't start moving in the right direction, that this could be a lockdown that lasts well into December, if not beyond.
Thank you very much. Olly Barratt coming to us from London.